So hi everybody. I'm Macey Levan here with Dr. Kyle Jackson from the University of Pennsylvania in Philadelphia, Pennsylvania in the United States. And Dr. Jackson has been a wonderful contributor to the Transplantation Journal. He's written many papers, and so today I've asked him to come and talk with us about some of his favorites. So welcome, Kyle.
Thanks, Macey. Thanks for having me. Always good to see you and talk to you. I love talking about science and paper and how we can kind of improve the care of transplant patients.
Yeah, so you're a transplant surgeon, right?
I am, yeah. So I'm one of the kidney pancreas transplant surgeons at Penn, and it's been awesome. And I kind of love blending clinical medicine and doing transplant surgery and also doing science and publishing it in journals like Transplantation.
Right, so you're a surgeon scientist. Tell me about your training.
So I was at Hopkins for general surgery residency, where I worked with Dori Segev and you and kind of other brilliant people who are in the field of transplantation science. And I think that kind of training is wonderful and very multidisciplinary, very diverse. You learn a lot of different cool skill sets from people, and you get a PhD, and then you're kind of in clinical fellowship for a while, which I did at Emory, and now kind of starting on faculty, I'm finally able to start to grow and kind of do the science that I want to do, and kind of try to find sets of people like what I had at Hopkins and with you and Dori and others. So that's been fun and challenging.
So you were a surgical resident, and then you took time off from that to actually spend time doing science and getting your PhD. And what was your PhD in?
So my PhD was, I did a lot of work in kind of two main spaces. So it was mostly in kind of how to take care of the highly sensitized kidney transplant candidate and kind of allocation policy surrounding that, and thinking about equity and what's fair, and what have changes in the allocation policy done. And then when they get a kidney, or how do we get a kidney, whether it's through desensitization or kidney pair donation, or kind of taking advantage of the policy changes that we all kind of worked on together to help figure out. So kind of navigating all of those different challenges was what I got my PhD in.
And so did you publish any of your PhD work in the journal, or was that another?
No, one of my favorite papers that I'm really happy to talk about here was from that work. And one of the things that we did was, Dori and Hopkins had run this massive multi-center study of incompatible living donor kidney transplant recipients, and thinking about desensitization and how do we capture that and how do we study that? How do we see what works? How do we see how centers do and which centers do better? And one paper that I wrote in the journal was on center level variation and outcomes with incompatible living donor kidney transplantation. I think that's a really cool topic, because it's not necessarily a common situation. And so a lot of times, frequently, you're doing this procedure, this operation in a setting where maybe you wouldn't have done very much. And a lot of the surgical literature is such that more volume equals better outcomes. And we wanted to test that to see if that same paradigm applies to ILDKT, or incompatible living donor kidney transplants. And what we found was that actually most centers are really, really good at doing those things. There's a lot of expertise that goes into picking the right patients, picking the right treatment regimens, and kind of getting a patient through it. And what we found was that really patients and the differences between patients drive outcomes. And centers should feel free to do this and use this when it makes sense for their patient. And they'll probably do a really good job.
Fantastic. So that's science in action, actually making a difference here, right?
Yeah.
So
absolutely.
What other papers did you publish that you want to talk about today?
So I think we're always trying to use really cool statistical methodology and kind of innovative study designs and ways to improve care of patients. And I think one of the cool things about being in transplant is there's so many different types, of transplant recipients: kidneys, livers, pancreases. And so one study that I did in liver transplant recipients was, how do we, one of the things that you think about is we have all these marginal organs, or donors that aren't quite perfect, or donor livers that aren't quite perfect. And how do you use them in a responsible way that is right for the patient, but also kind of helps us use organs that maybe we wouldn't have in a different situation. And so what we looked at was, is there a certain type of recipient, or is there a recipient phenotype that can take some of sorry, I'll do a little reset real fast. That can take the hit, or the kind of the impact of one of these marginal livers, like a fatty liver, and do really well with it. And what we found is that when you do the math and you set things up in kind of an interesting way, you can find that there really are certain types of patients that actually do just fine with a fatty liver or whatever. And so kind of thinking about ways to find the right recipient for a given donor, and you can do that with science.
Fantastic. So let me just be straight with you. So science actually makes a big difference in how you care for patients. And the papers that you publish can make a difference in how you treat patients in the clinic, right?
I think so. That's at least what I believe.
I think that's amazing. I think sometimes we think we write a lot of papers and we do a lot of cool math and we do statistics and we make these papers and we send for publication. But they really do have a real world impact. And so I thank you for your work, because I've seen that happen in the world, right? So he's mentioned incompatible kidney transplantation. Yeah. Can we just break that down for people just in case they're unaware of what that means? Yeah,
so I think when we kind of use that colloquially, a lot of times we mean that there's donors and recipients, and in a perfect world, everyone's compatible, and a recipient can take a donor kidney from that person. Mm-hmm. There's blood type incompatibility and kind of HLA or antibody incompatibility, and there's a lot of different ways to think about those. But when we say incompatible living donor kidney transplantation, what we're talking about are ways to facilitate transplantation across one or both of those barriers, whether it's blood group or kind of antibody, and the various different strategies that are being done. And there's a lot of really cool work that comes out in transplantation about unique and novel ways to do that really do make a difference, kind of in the moment for a patient, and you kind of have to try to figure out what works.
All right, I'm going to take a couple of beats and recap a little bit about WTC. We're going to do a podcast about the whole being at the World Transplant Congress. So pretend that you've already been here and this is coming out later. What has been your favorite part of attending the World Transplant Congress for the first time in 10 years?
It's seeing all the cool people that you interact with online or through journal reviews or through whatever, and just seeing people in person and hearing them talk about all the really cool things that they do. I think it's always great to read a great journal article and kind of read what people are thinking. It's another to watch them talk about it and see what they're thinking about next and see where the field goes. And you meet a lot of really cool people doing cool things, and you think about how you can kind of connect and interact and do team science and kind of take that to the next level. And so just seeing everyone and talking to everyone, I think, has been my favorite part.
How about San Francisco? Do you like it here?
I love the weather.
Yeah.
It's just, being from Texas and now in Philadelphia, it's very hot right now.
Yeah.
So I think it's been really, really nice.
So a nice cool down. And I think it's a great location, because I know we've had a lot of people coming from Asia and around the world. It's just been a great meeting point.
Yeah, and it's obviously a beautiful city and lots of stuff to do. So I think it's been awesome.
Fantastic. My last question for you, Kyle, is you have gone through a very long training to get to where you are. You're an attending, you run a transplant center at Penn, you work with great people there, right? What advice would you give to someone that's just starting to learn about our field, and maybe they're interested in being a surgeon scientist, but they don't really know where to go? What advice would you give them?
I just reach out and talk to people. Transplant is the coolest field. Obviously, I'm biased to surgery, but there's plenty of other cool parts of transplant. And if you talk to people, no one loves transplant more than us, and we'll get you involved. We'll get you there. And if you want to do science, there's probably a lot of really great scientists at your institution, but people love talking about their science too. And so if you can find a way to integrate those and just reach out, we would love to get you involved and get you going.
Fantastic. Well, you heard it from Dr. Kyle Jackson himself. Thank you so much for joining the Transplantation Podcast. I appreciate your time.
Thanks so much, Macey.
Thanks.